arthritis patients, spine pain, regular knee pains, what happens is nowadays 40 to 50% of the surgeries are not required, but they are being done in a fashionable routine way. So what you can do is, I can see an X-ray, I can prescribe her physiotherapy, I can give her completely natural medicines and natural treatments according to her reports and X-ray, and once she enrolls for my treatment of physiotherapy, it will be a lump sum with physiotherapy, treatment and natural medicine and some natural diets and stuff which she has to follow. All in all, what happens is within like say 15-20 days, she can cure like 60 to 70% of her pain will be reduced. She'll get a pain relief, she'll be cured, her arthritis will be reduced, osteoporosis or maybe whatever disc problems, bone weakening, whatever she has on muscle strengthening can be taken care of. Like not necessary a surgery has to be done. Yes, very intense cases you require a surgery. As much as possible, we try, as a naturopathic doctor, I try to avoid surgeries.
Okay, is your medicine 100% vegetarian?
It's 100% natural, 100% vegetarian, safe, no side effects.
Okay, and do you treat diabetic patients also?
Diabetes is one thing, like I would say ki my treatment is the best. And yes, I can give you around, like right from 400 milligram sugar. I can reduce that patient's sugar to 130 or 150, in between this 120 to 150 or maybe 130 to 150 within 5 days or maybe even earlier. I can treat diabetes so well, and that too without any allopathic prescriptions, 100% natural way. And after that, if the patient has to continue a treatment for 3 to 4 months, I can say that today a patient who says like I have diabetes from 10 to 15 years, I can say that he can or she can reverse his diabetes, not reduce also. If he or she takes a treatment for 3 to 6 months perfectly, how I prescribe, with insulin stimulation, with glucose reduction, and that too at a very fast level with 100% natural treatments and a good lifestyle modification, that patient can...
diets also?
Medical nutrition therapy, I would call it, instead of a diet. Diet means all crash dieting and starvation. I don't believe in that, because your body needs fuel to eat. If you start dieting, your body will rob your muscles for energy, and then you start losing muscles and you get a loose body. So this is a medical nutrition therapy essential for diabetes, which the patient has to follow, and overall में उसका diabetes reverse भी होगा, और अगर वो जरा जल्दी शुरू करे अगर मेरा ट्रीटमेंट, तो उसको आगे आने वाले complications भी नहीं होंगे. डायबिटीज के जो complications होते हैं उससे भी बच जाएगा.
What kind of a complications are you talking about?
Nephropathy, neuropathy, foot. The whole.
Because usually what happens ki when you have diabetic, your next step is dialysis, which is very commonly
the next step is dialysis, but in what case, what manner? If the person has a BP and probably he's taking BP, obviously he'll get an acute renal failure with continuous BP medications. If the high BP medications can be curbed, and if diabetes is stabilized, yes, of course, I can help in high blood pressure. I can do like blood pressure reduction, high blood pressure reduction without any BP medications, which will prevent the person from having an acute renal failure later on in his life years. उसी टाइम देखिए कोई साइड इफेक्ट दिखने वाला नहीं है, पेशेंट खुश रहता है, सब कुछ हील हो गया. इट इज बेसिकली लाइक एक हिस्से में जो प्रॉब्लम हो रहा है उसको उधर दब गया प्रॉब्लम दवाइयों से, दूसरे हिस्से में वो चालू हो सकता है, या तो जो जर्म्स है वो उस हिस्से पे मर गए दवाइयों से. But in my treatment, natural treatment I give you, on which I treat the human body on the whole, I will remove all the waste material on which the germs thrive. So there is very less chances of any complications in the near future. Therefore, natural treatments are 100% safe and without side effects. Side effects अभी जो उठेंगे 5-7 दिन में नहीं, 5-7 सालों बाद भी नहीं उठेंगे.
So that means you will recommend us to have your continue your allopathic, and then along with that we are having your natural food.
First I will see that how much allopathic medications are you taking. I will not stop them all at once. I will reduce them. Then I will reduce, and there will be a stage where I will tell you to stop. You can stop because you have come to that level of healthy. You will stop, right? Yeah. I believe that nobody should be on medications. दवाइयों पे मत रहो. बॉडी को ऑन द होल इतना अच्छा बनाइए कि सब कुछ हील रहे, दूसरी बीमारियां नहीं पकड़े, एक बीमारी भी हट जाए और दूसरी बीमारियां नहीं पकड़े, साइड इफेक्ट्स नहीं हो. अभी नहीं, 5-7 दिनों में नहीं, 5-7 सालों में भी आपको साइड इफेक्ट्स नहीं होने चाहिए.
ओके,
या